We make sure everything in the city runs well. Ntate bring Utlile joiner today. Kidu Medise, our ED for the Department Dear Health, Ntate Dr. Basmela, who's here today as well, and Melisiwe. Thank you so much for coming to support us today. We know how much you love your region. I'm sure you're very happy to see your mobile clinic has finally arrived. I'm told it's already started working. I don't know if you've done rounds yet. If you haven't, please do. I'm told we've already started seeing clients. I think we've seen about 33 clients so far, and so far so good. So I'm getting very good feedback. As Councillor Maponyane has already stated, in the city of Joburg, we are in a coalition governance arrangement where the Democratic Alliance is not governing alone. We're governing with smaller parties and the EFF as well, and it helps because we're able to come together as different parties and say, how do we solve this problem? And we're really very grateful to the EFF for this brilliant idea of having mobile clinics in the city of Johannesburg. Indeed, they brought the motion to council. It was supported by the DA and the smaller parties, and today we're able to deliver this clinic to you today. So thank you very much, Councillor Maponyane. Let's continue working together to build our city, the city of Johannesburg, bringing residents the services that they need. Harabuaka Healthcare, an agency that's responsible for healthcare worldwide, the Bariki World Health Organization. World Health Organization, the type of care that you should be getting that had really robi. I get it. Now, World Health Organization is access to healthcare within a 5-kilometer radius. More than 5 kilometers. World Health Organization. Now, how the Constitution of South Africa, Leone, how you Section 27 access to healthcare, including reproductive health. So Mola wale protect the residents, most city of Johannesburg, who can need to access to healthcare. And I see you as government to do something to make sure that Liba Leone. Now Harry Joburg all the time. Hunali the new settlements all the time. Hunali the informal settlements, there more than 200, I'm told, today. And every time those settlements come up, the issue of services comes up. Government, is there a clinic nearby? And if there is no clinic nearby, now how are we going to provide healthcare services? These mobile clinics, they're going to be shared. So Kikupa will a background of how this is going to work. I get it. Clinic A mobile because we wanted to be able to move around. Rebatla gore iye mo khonaleng tlhoko mo teng ne ha re batle e dule pleke A1. So ha re lebella mo region ya lona ke lona mo Klipfontein le batho ba Kaya Senza ke ra itse Kaya Senza. Kaya Senza le yone na le bothata ha bana clinic ba tshwana le lona yana ne. So le tlo go share, okay? Clinic e le tlo go share le batho ba Kaya Senza, but for now let's come back change for now go Kaya Senza re santsana really busy ka permission gore e phaka mo e tlo phakang mo teng mo lona e tlo phaka gone mo ne. So for now you can have it for all 4 days. It will be 4 days in a week because day 5 re tshwantse re service re tshwantse re replace ditlhare re clean re make sure gore e right akere go cleaner every day, but I mean service akere re tshwantse re check gore everything is in order and it's ready for the following week. It's going to work from Monday to Thursday. So for now le kansela enjoy from Monday to Thursday for now. Mara ko pareskalwana ha re tlo stopa di Wednesdays, lady Thursdays, I get Wednesdays and Thursdays, it will go Kaya Senza RD, Kopa or Tuesday to make that very clear so that we don't have problems when it's supposed to start going to Kaya Senza. So let's make sure our residents here are aware. It's only here for Mondays and Tuesdays, but for now, because Kaya Senza is not yet ready to receive us, you guys can continue using it. I get Councillor, we clear. Councillor Maponyane, it's clear. So please let's help each other so that we don't fight. Now, a little bit about this mobile truck. It's about informal settlements I get all the time. So I see on a fella, resimulate go region G, go loli, Leona it's a Maya region G, all the places in the region that need it, it's a Maya mo fella yalo. And then from there, Rile go region F last week, ne Rilo deliver ko Jeppes Town, it go to Sana li Jeppes Town, it go to Sana Hapeli li Boisons. Okay? So it's covering 2 wards. Now Ritilemo. Before we start to roll out these big ones, April or May this year, PPC cement, but City of Joburg, something because Naledi operations close to you guys. We want to give something to the city, and we've done a bit of homework, and we see that there's a gap. Mobile clinic, I get it. So Barifile mobile clinic, it was the first one. So 8 that we are rolling out, ne? But has it on a fail? Re kgone kry budget ya go ba le di mobile clinic 10 in total. Ha ke balella ya bo ya PPC. So the city is procuring 9, PPC ya refa ya bo 10. So all in all, the city will be having 10 mobile facilities. As I've already said, the informal settlements didn't get. I said there's more than 200. So we don't need one, we need more than one, so that we can cover all those areas. But and then Councillor Maponyanu Tsabua about Batuba Baling bedridden again. We're aware in some of our communities, some people really are too far from clinics. Sometimes twanzora here transport, twanza here van pension, clinicking, and it's really not fair. Some people with disabilities who are living with disabilities transport, and it's really not fair. So these mobile clinics are also going to help for that. That's why Councillor Maponyana was saying, let's please inform them. Something at least. But Councillor, those people who are bedridden, let's engage our community health workers. Dr. Basmela, let's engage our community health workers. Let us know them, because Merakwadi community health workers is to know those vulnerable households that require household level interventions. I get it. And Badali team leader who is a nurse. So if that person really cannot leave the home, the team leader should also be able to assist by visiting them at home. So it would really be helpful, Councillor Nkomo, if we can get a list of such people who are bedridden, who cannot even access their mobile clinic, so that we can help them through the community health worker program. Now a little bit about this truck. Isn't it beautiful? Yes. Isn't it nice and big? Yes. I'm going to tell you a little bit about the features that it has. It's very staff friendly. I see our staff are here as well. Are you excited? Are you enjoying it? I know you started using it. It's very friendly for staff. They can sit nicely. They've got safety belts as well. I know that it's got 2 compartments. So in terms of consulting rooms, 2 consulting rooms. It's very private. So don't worry, maybe get tracker. It's very private. You'll have that same privacy that you have at a normal clinic. It's also got an emergency room. So if we deliver speed, we can do it right here. Are we ready, our staff? We're ready to deliver those emergency babies who come when we least expect them. This truck is fitted. It's got equipment. It's ready. It can do wonders. And I can have a wheelchair. It does this device. Steps again. Or if mutatamanga crutches or wheelchair. This thing, what we can fella on Namodima wheelchair, you sit on the wheelchair, and then how you get into the clinic, what to see you. City of Joburg, it cares. I'm a City of Joburg,